trying to transform quality care, healthcare in Uganda. You've put your money on the line, trying to take those services back to Uganda. Bring me up to speed. What is it that you've been able to do this far?
We named it Empowering Home Care after seeing that what we do, what our aging population needs in Uganda is really craving and hungry for services that are needed to keep them cared for with a sense of integrity. Our aging population is left isolated, kind of neglected, and there are things that that could be solved if they were taken care of. There's so many frequent hospitalizations with the elderly for wounds that we would prevent, sicknesses. My mother is 81 years now. My mother lives in the village. She has elder age chronic diseases, which is blood pressure, diabetes. She forgets because she's aging, and sometimes they don't know the art of hygiene. So looking at my mother, she's non-compliant with blood pressure medications. So she gets to the hospital when her blood pressure is very high and uncontrollable. So these are some of the things that if someone really with basic training knew how to manage an old person at home like this, we would avoid hospitalization.
You gave a very telling story about your mother, and there are a lot of people who share the same view. What can Vantage Care do for them to help their parents?
We focus on preventive and safety. We rehabilitate patients who have lost the use of their arms. Think of a stroke person. People recover from stroke, and people who don't get rehabilitation, they die. I mean, you have someone at home who can't feed themselves. We know how to make the texture of the food that someone can swallow very well without choking, repositioning a patient who has a stroke, so prevent skin breakdown, help people walk safely with someone who knows which side to use when ambulating someone who has one side weakness. Hygiene, some of these people they stay in their rooms, and because they are afraid to be, they feel they have lost control of their urine and the feces, the bowels. So knowing that I have someone who can clean me anytime I get an accident, then I come back into the community. Someone is actually asking me, do you need a glass of juice? Do you need a snack? Can we take a walk? This is personalized care. I mean, how can you beat that?
You're trying to basically transfer technology to Uganda. You're buying equipment here and ship to Uganda. From a logistical point of view, how easy is that?
We have been trying to gather a number of equipment, and thank God we were able also to get accepted to bring in donations to the elder people who need semi-hospital beds, wheelchairs, walkers, canes.
As an experienced medical personnel here in the United States, the type of training that you undergo to become certified or professional at what you do, what kind of training are you offering to Ugandans who want to do this job?
Home care is very critical. It's basic, offering basic services, but it's very essential and very vital. We really focus on kindness, empathy, compassion, and treating people with a sense of integrity. We teach how to communicate, the art of communication, body language, verbal, and also what should they really report to the family members, loved ones. Safe transfers from bed to chair, from chair to bed to different places. So we don't have our clients' skin breakdowns or skin tears.
Thank you so much for your time.
Thank you again.